Good evening. I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720, or if you're calling coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at wfwa.org. That's mattersofthemind at wfwa.org. And I'll start tonight's program with an email I received this past week. It reads, Dear Dr. Fawver, how can NAC, also known as N-acetylcysteine, be therapeutic for psychiatric conditions such as ADHD, anxiety, and depression? Well, NAC is a sulfur derivative, and if you have a sulfur allergy, you shouldn't take NAC. But NAC is an interesting product because it is a supplement that can be helpful for the conditions in which you mentioned, ADHD, depression, and anxiety. Should everybody take it? It depends. But 600 milligrams twice a day is the usual dosage. Most people tolerate it quite nicely. Here's what it does. It basically cleans up the mess around neurons. Each of your individual neurons in the gray matter of your brain, which is the outside part of your brain, have 8 to 10 of these little glial cells around them. The glial cells are like the pit crew at NASCAR or IndyCar, all right? So imagine having a pit crew around your individual neurons, 8 to 10 pit crew, and they clean up the mess. So if you watch NASCAR or IndyCar racing, you'll see that the pit crew is cleaning up tires and they're taking care of things. Imagine if that pit crew was not working together. Imagine if that pit crew wasn't working efficiently. Well, what'll happen is you'll have a slower pit stop and that'll lose the race for you. So what you want is a very efficient pit crew that not only nourishes the car, or in this case the neurons themselves, but actually cleans up the mess. What NAC will do is clean up the mess around the neurons. What happens, these glial cells, which are the pit crew, sometimes get a little sickly, especially as we get older and especially as people are going through a lot of stress. If you're going through really tough stuff day by day, your little glial cells get more sickly. So your pit crew, taking care of your neurons and nourishing the neurons and cleaning things up around the neurons, they get more sickly, and that makes things not work so well. And actually your neurons start to shrivel up because of that. So what NAC will do is help get the junk out of around the outside of the neuron by increasing the vacuuming ability of the actual pit crew, the glial cells. So it cleans up the mess. So bottom line is, when people take NAC, they'll notice many times that they will have a bit less anxiety. It won't help everybody, but it sure is worth a try. And I'm always encouraging people to ask their clinicians what supplements they might take. So if you ask your clinician what supplement he or she takes, I think clinicians should be forthcoming and tell people. And I take NAC myself. So NAC, 600 milligrams twice a day, is a commonly recommended adjunctive treatment for anxiety, depression, focus, concentration, but it's something that is an extra expense, so you have to balance that out with your prescription medications. Obviously, insurance will not cover NAC, so you'll be paying out of pocket, but it is an over-the-counter product that typically is really well tolerated. Occasionally, people will have a little bit of nausea if they get too much NAC, but generally it's very well tolerated, can be taken with or without food. Morning and evening is how you typically take it. Thanks for your email. Let's go to our first caller for tonight. Hello, Brenda. Welcome to Matters of the Mind. Brenda, you want to know about Rexulti. What is it, and why would somebody need to add it to their depression medication? Rexulti is brexpiprazole. It's a chemical cousin to aripiprazole, which is Abilify, which has been around for a long time. Abilify and Rexulti are added on to existing antidepressant medications, sometimes to make them work a little bit better. It's kind of like adding extra seasoning to an antidepressant medication. Rexulti, brexpiprazole, is particularly good at helping people with post-traumatic stress symptoms as well, either by itself or with an antidepressant medication. What it will do is fine-tune the serotonin, norepinephrine, and dopamine functioning, and it's kind of like a means of helping the depression treatment along a little bit better. And Rexulti is particularly good for people who have a sense of feeling wired and revved up, but yet they're tired. it sounds like a strange type of symptom complex, but some people feel kind of revved up and anxious, but at the same time they're exhausted. Rexulti is particularly good for helping those kind of symptoms for those people. So Rexulti is commonly added on at a very low dosage. It's also used for schizophrenia and bipolar disorder, but it can be used as an add-on medication for a lot of people who are not getting adequate relief from their existing antidepressant medication. Brenda, thanks for your call. Let's go to our next caller. Hello, Charlotte. Welcome to Matters of Mind. Charlotte, you want to know how important is it for someone who has postpartum depression not to isolate themselves? That's very important that they not isolate themselves. Charlotte, I talked to a lady just this afternoon who was experiencing postpartum depression, and we were talking about this phenomenon. So postpartum depression is a situation where within a year of your delivery, particularly the first 3 months after a delivery, a woman can get unnaturally depressed day by day. She'll notice that she can't take care of her baby, not uncommonly. Socialization, difficulty with concentration, fatigue are particularly problematic. It happens in as many as 10% of women after they deliver a baby. Postpartum psychosis is a different phenomenon that occurs in just a small number of people, but that's where women actually get psychotic and they lose touch with reality. Now, when somebody has postpartum depression, Charlotte, I want them to not isolate themselves, because if you withdraw from people around you, it's actually a precursor and a predictor for getting more depressed. That's the case for all of us. So we all need to stay engaged with people. It's a natural type of expectation that we all will experience. So we need to be around people, and if you socially withdraw, that will be problematic for you. So being around family, friends, getting out every now and then can be very, very helpful. Charlotte, thanks for your call. Let's go to our next caller. Hello, Fred. Welcome to Matters of Mind.
Thank you, sir. You are so good.
Thank you, Fred.
I ordered your book, Man's Search for Meaning.
You did,
Frankl.
That's not my book. Yes, thank you for not making me the author on that, Fred. Because
no.
Viktor Frankl is a brilliant psychiatrist who was doing a lot of work back in the 1930s and 1940s. But you've not read it yet.
Well, I've read it, and I was a refugee caseworker for 29 different nations, welcoming them to Fort Wayne.
Wow.
And it's such a broad-based approach to humanity, because, I mean, from many countries, many religions, many cultures, it's really a good base for social work reading.
It is, Fred, because somebody asked me a few weeks ago, you must have been watching that episode, if I could recommend one book for people outside of the Bible, what would I recommend for them? And that's what I recommended, Man's Search for Meaning by Viktor Frankl, that was written back in the late 1940s after he got out of the concentration camp. And he was going head-to-head with Sigmund Freud and Carl Jung back in the 1930s, because they had these different techniques. He basically said, when a person has trouble with depression and anxiety, basically it's related to they're not having meaning in their lives. And we've known all along that lack of meaning is a predictor for suicide.
Well, it's tremendously applicable to people who have found themselves in a country they don't know about. And it's just so applicable to that type of approach and everything else. I ordered it that night. And I ordered, they called it the Youth Edition, and it has a lot of extra articles in it.
Yeah, Viktor Frankl's grandson has taken up his work and is still expanding that, but it's called logotherapy, where basically it's a therapy where as you're talking to somebody, you're trying to find out what's really important for them, what they can look forward to. And Fred, a big area of research in psychiatry right now, and something we're always examining, will be the whole concept of anhedonia. There's the consumptory anhedonia, where you can't enjoy things like a chocolate cake, or you can't enjoy a concert. You just can't enjoy things at all. And then you have the anticipatory anhedonia, where you don't think about enjoying things in the future. So this whole concept of anhedonia gives us meaning because it allows us to look forward to something, and that's kind of the basis behind logotherapy that Viktor Frankl was talking about.
That's featured in the book, and I really enjoyed it.
Didn't you enjoy his actually going through the details of his experience in the concentration camp?
Yes, well, it mirrored so many things.
Oh, wow.
Many refugees come with little or no hope.
Yeah.
or knowledge.
Yeah.
And then you try to say, you could do this, maybe. Think about it. But the best was when they would come with an idea just out of the blue
Yeah.
and be brave enough to go after it. It was fulfilling.
Yeah, and I'm sure it wasn't lost on you, but Dr. Frankel mentioned that in the concentration camp, the people who lost meaning and purpose to their lives, those are the ones who died. The people who had anything to look forward to kept going on. And I think that's so indicative of what we all go through in life, Fred.
Well, it's everybody. Then so many negative things among refugee experiences.
Yeah.
And so much hope built watching other people succeed.
Yeah.
It was wonderful. Thank you.
Well, thank you so much for your work, Fred, with the refugees. Have a good evening. Let's go to the next caller. Hello, Matthew. Welcome to Mayor's of Mind.
Hi, Dr. Fawver. This is Matthew Crable.
Hi, Matthew.
I got a question. I got sugar diabetes type 2, and I wanted to know about metformin I take for my with other psych meds I take, and can that lower your A1C or?
Yeah, Matthew, thanks for your call. Metformin as a medication has been around for decades. It used to be called glucophage as a brand name medication. Metformin is a $4 a month medication for a lot of people nowadays. So it's very affordable and it's very effective, especially for people who are taking an antipsychotic medication like Latuda or Lorazepam. It's a medication that will basically decrease the absorption of glucose in your gut, and then it decreases the production of glucose in your liver. So in other words, it makes insulin a little bit more sensitized. So it's a very well-tolerated medication for a lot of people. If it gives you any nausea, many people take the controlled acting formulation, which would be 1,000 milligrams and then controlled release tablet every day. People typically will go to 1,000, 2,000 milligrams is not uncommon as well. But the higher doses sometimes can give people diarrhea, and that can be problematic for some people. And that's where they can split up the dosage some. But metformin is a very inexpensive, safe, and very effective medication in terms of decreasing the likelihood of developing type 2 diabetes. And if you have type 2 diabetes, you bet, Matthew, it can decrease your A1C, which is basically a measure of your average glucose for the past 90 days. A1C looks at a little chemical component in your blood cells, and it holds on to glucose, and it does so over the course of 90 days, and A1C basically is a measure of how much it does that. So the higher the A1C, the more glucose you've had on an average basis. But metformin is a very well recommended medication for anybody who's is on an antipsychotic medication. If they have a diagnosis of schizophrenia, bipolar disorder, those diagnoses in themselves will put you at higher risk for glucose disturbances, because if you have a psychiatric condition such as those, they can cause you to have difficulties with cortisol metabolism and thereby give you difficulty with glucose itself. Matthew, thanks for your call. Let's go to our next email question. Our next email reads, Dear Dr. Fawver, how do traumatic experiences affect memory, and can they alter untreated memory? Can you alter untreated memories over time? How do people heal from trauma? Basically, the earlier in your life where you've experienced trauma, the more impactful it can be on your brain long term. And the general rule of thumb is if you've experienced trauma before the age of 8 years old, trauma being emotional abuse, sexual abuse, physical abuse, your parents got divorced, or somebody in the family were drinking alcohol, somebody in the family got jailed, some kind of significant trauma as a young child, that can have significant effects on the brain, but it's not necessarily permanent effects on the brain. But if somebody had a lot of trauma prior to the age of 8 years old, for instance, they're less likely to respond later on in life to a serotonin-based antidepressant medication. And it's a predictor for an antidepressant medication of a certain class not to work. That class is the so-called selective serotonin reuptake inhibitors. So if you had a lot of early childhood trauma, you're not as likely compared to other medications to respond to Prozac, Paxil, Zoloft, Celexa, Lexapro, Luvox. These are medications used for depression very commonly, but a predictor for those medications not to work will be especially early childhood trauma. Now, why does that happen? In your early childhood, your brain is developing. It's growing in some areas, it's shrinking in other areas. Now, it's good for some of our neurons to kind of shrivel up. We call it apoptosis. It's where they are basically getting pruned. So if you have a tree out in your yard, it's good for a healthy tree, especially a fruit tree, for instance, to prune it down a little bit and take off the dead branches or the branches that aren't really useful, because that makes the tree more healthy. Rose bushes, good example there too. The more you selectively prune rose bushes, you'll get more beautiful blossoms coming out. You want to prune your trees in the same way your brain naturally will prune itself. The concept is called neuroplasticity, where you'll have some of the brain getting more fluffy, others getting pruned. Now, a healthy brain will know to prune off the area that is causing you traumatic memories. Now, you can actually get rid of some of the traumatic memories in various ways. There are treatments such as eye movement desensitization and reprocessing that will focus on specific ways of dealing with traumatic memories. But if you had early childhood traumatic memories, from a medication standpoint, we're going to be very careful on what medication we might be able to utilize. But yes, you can recover from past trauma in various ways. But from a biological standpoint of the brain, what you're trying to do is get more pruning of the bad memories and get rid of those branches that are causing that. As you continue to ruminate and focus on the bad memories, it's thought that you can actually cause more branching of the neurons that are responsible for the bad memories. That's not a good thing. So we try to get people to divert their attention to thinking more, well, to put it quite simply, happy thoughts and more constructive thoughts, to try to delegitimize the bad memories you had from the past. So it's an interesting phenomenon that occurs, but you can recover from past trauma by various treatment strategies. One of the treatment strategies, very practically, will be to have some kind of purpose and meaning that gives you a drive for looking forward to the future. So we will often have people involved in focusing on their purpose and meaning in life. Fred talked earlier about Viktor Frankl's book, Man's Search for Meaning, that is basically focused on that whole treatment strategy itself. And it's a very good way of dealing with trauma. Finding a purpose, finding meaning, having something to look forward to on a day-to-day basis. Thanks for your call. Let's go to our next caller. Hello, Mary. Welcome to Matters of the Mind.
Hello?
Hello, Mary. I can hear you loudly and clearly.
Yes. I have been having auditory hallucinations, as in music,
Okay.
since April of last year. And I am currently on 2 medications. One is lamotrigine, and the other being lorazepam. And my psychiatrist has tried to change one of those to a more effective medication, hopefully, for those hallucinations. But insurance hasn't covered either of them without an exorbitant cost. Do you have suggestions on the type of therapy? Anything else that I could try?
I'm curious, Mary, what's the nature of your auditory hallucinations? You mentioned they started about 1.5 years ago and they involved music?
Actually, a year ago, April, and it is music. It can be phrases of music that are just repetitive, and or 3 notes in their own. It's very odd. If I don't have something musical to avert those limited bits of notes or phrases, then they just repetitively go on in my mind.
Is the music involving musical notes, or is it a song where you can actually hear the lyrics?
It's the musical notes.
Just notes, no words?
Yeah. No.
Okay.
Mm-hmm.
And I hate to ask a woman for her age, but Mary, give me
62.
within a decade. How old were you when it started?
62.
Oh my goodness. Okay.
No. I am 62, and it started a month before my birthday in May.
Wow.
24.
Now,
24.
have you seen a neurologist?
No, I'm strictly seeing my psychiatrist.
Okay. And how were you doing before this past year or so from a mental health standpoint? Did you have any depression,
Well,
anxiety, any problems to speak of on a day-to-day
I
basis?
had a delusional episode 3 in one day, and so I was hospitalized. But since that point, I have not. And that was December of 23.
Okay. Well, let's go back even further. How were you doing before 2020?
Bipolar, PTSD,
Okay.
anxiety, sleep disorder.
Okay. So yeah, you had a few things going on prior to 2020 with your mood that was already there, correct?
Mm-hmm.
Okay. Did you have COVID?
No,
You never had a COVID infection.
no.
Fantastic. I did hear about people having strange neurological type of symptoms happening after a COVID infection, so we don't have to worry about that for you. Yeah, I think lamotrigine is a very good medication for you because what you're describing is kind of like a neurological phenomenon. Lamotrigine, Lamictal, is often used for mood stabilization, but we'll use it for these, kind of odd neurological symptoms. Now, you're describing a type of auditory hallucination that we would call an elementary auditory hallucination. In other words, it's not first degree, it's not second degree. Those kind of auditory hallucinations involve voices, either talking outside your head, inside your head. You're describing music, and it can be annoying, but it's not considered to be as pathological as other conditions. Now, will your insurance cover medications, as you'd mentioned, Lurisidone, which is Latuda? Will it cover those type of things? I like the idea that your psychiatrist is trying the less toxic type of medications for you, and Latuda, Lurisidone is one of them. There are newer medications coming out, but I think a kind of medication that would give you a little bit of that antipsychotic effect could be helpful. But I'm wondering, you're talking about elementary hallucinations, and these aren't the first and second order hallucinations, which tells me maybe an antipsychotic medication wouldn't be what you actually need anyway. Perhaps something along the lines of something that would block excessive glutamate. On one hand, lamotrigine does decrease the firing of glutamate, but glutamate is the excitatory chemical in the brain. When you hear music, especially when you're singing, you're going to be using this right front part of your brain. So the musical network is different from the voice network, and that's why it's important to understand that, okay, these are elementary hallucinations involving music, and they're not first and second order hallucinations involving people's voices. So with that being said, you might want to consider treatment or talk to this with your psychiatrist about the possibility of a medication that would block glutamate. Now, had you ever taken a medication, even at low doses, called Depakote? That ring a bell?
No, I have never taken that.
Depakote, I don't want you to take tiny doses of it. Depakote actually decreases and blocks glutamate, and you can use it on top of lamotrigine. They work in tandem that way. But if you have excessive excitatory glutamate in your brain will fire unnaturally, and it's kind of like having a seizure in that sense, but you're having a seizure of music, so to speak. Now, there's a phenomenon that's really annoying to some people. It's called an earworm, where they just hear a song going over and over in their heads, and they do the same thing you will do to cope with that. They will listen to music, or they'll try to do something to distract themselves, and that's one technique. But if you're really trying to biologically take care of this music that is distinctly audible, and it's really annoying, that's where I'd wonder if you could go a different direction. Yeah, you could try the antipsychotic medications that basically block dopamine, but I think maybe it's a condition from a neurological standpoint. If it just came on when you're at the young age of 61, 62 years old, if it just came on, it might have been a slight neurological development that could be maybe mitigated by something that blocks glutamate. So maybe going with a second medication on top of lamotrigine that would do that. Depakote as one of those medications, and it's very, very inexpensive. So that would be something that would be affordable. Mary, keep in contact with your psychiatrist because that should be a treatable condition for you.
Okay, thank you.
Okay, take care, Mary. Thanks for calling.
Mm-hmm.
Let's go to our last caller. Hello, Greg. Welcome to Mayor's the Mind. Greg, you want to know how important is it to take breaks for your mental health in a high-stress job? The best thing you can do, if you can do it, Greg, is take about a 20-minute nap late afternoon. I recommend this to medical students. I recommend it to a lot of people who are thinking all day long, and they're in a high-stress job. This left front part of your brain, which is called the dorsolateral prefrontal cortex, works really hard when you're thinking. You're really focusing on things, and that's why your brain kind of feels tired when you've been on a high-stress job for a long time. If you take a 20-minute, 30-minute nap, what you do is you basically just refresh this part of the brain, and it's kind of like just erasing your inbox and just allowing your brain to rest. You'll remember things because that inbox up here will then transmit memories to your hippocampus down here on the side part of the brain. But if you can rest this part of the brain, it'll work so much better going into the evening. So the best thing you can do, go for a 20-minute walk maybe, but if you can get a nap for 20 or 30 minutes late in the afternoon, that's a tremendous way to kind of refresh your brain. Greg, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.